that's important to be part of the WHO. I think for Taiwan, notably to get information, to be able to talk with people, because you know that in international politics it's very important to meet people physically, to have the opportunity to meet with different ministers, to develop more cooperation. It's important also for the world to know that what Taiwan is doing. So that's a good platform actually for Taiwan to expose what are the success of Taiwan in terms of public health, but also the challenges for Taiwan, and to create network, to help Taiwan to be more efficient in its own foreign policy in this domain, but also to be more efficient here in different area of public health. So yeah, I think it's important to be part of the WHO, but it's not only this. I think there are many things that Taiwan can do at the regional level. Once again, I think it's important to work at the regional level, because Taiwan really can do many things with its different partners in the region. I would say that Taiwan also could join, not could join, but could be more active in the World Organization for Animal Health, because now we know that the OIE, Taiwan is a member. Taiwan is a member of this international organization. Few people know actually. Taiwan is a member, but I still found that Taiwan is not very active. But the idea recently was to link the human health and animal health, notably because we saw that during H1N1, H5N1, SARS, all the time there was a link between animal health and human health, and there is a kind of leitmotif saying one health, one world, one health. So I would say that one of the ways for Taiwan to be more visible, more active, would be to work more actively in this kind of organization. Could have a lot of impact, I'm sure, for Taiwan in terms of visibility and in terms of efficiency. In 2007 and 2008, actually, the CDC, the Center for Disease Control in Taiwan, wanted to cooperate more and more because of SARS, because of H1N1, with Hong Kong. And then from Hong Kong to have some idea of what happened actually in China. That's at the governmental level. It's still difficult. Right now, I didn't have any news about this kind of cooperation, the cross-strait infectious disease cooperation. I know that there is some kind of intervention of NGOs, Taiwanese NGOs in China, notably to help people infected by HIV/AIDS. But so far I didn't see any official and concrete cooperation between Taiwan and China. But I'm sure that the things will change probably, because we see that there is now a good cooperation between different hospitals in Taiwan and China, training, staff exchange, and so on. So the things will. Taiwan, that's very interesting, because there is every year in Japan or in Taiwan, there is an annual bilateral meeting on public health between Japan and Taiwan. And the recent years, most of the time, the main topics of this bilateral seminars or symposium, I don't remember the exact terms, but the exact words, but was on infectious disease and global health. Most of the time, they talk about tuberculosis, HIV/AIDS, or the health governance in Asia. So Japan is partners in this kind of action. Taiwan also in Asia also work with Vietnam, notably because we have a lot of Taiwanese Taishang entrepreneurs in Vietnam. For example, during the H5N1, Taiwan sent medicine over there, Tamiflu over there, to show its support. But still, most of the time, Taiwan is working alone to develop this kind of foreign policy, and then try to find partners in Europe also. In Europe, in US, the USA actually are very supportive to this kind of action. And in Africa, Taiwan has good partners, countries who really wants to work with Taiwan because they can benefit from this. And we find also a lot of Taiwanese researchers and diplomats who really think that they also can benefit from the situation, the evolution of the situation of public health, for example, in different countries, like in Gambia, like in Malawi, in Swaziland, in Sao Tome also, in Principe, very small island. So yeah, Taiwan try its best actually to be involved in these different global health governance institutions and so on. Benefit because, for example, a Taiwanese researcher, for example, in Taipei Medical University, there is a Taiwanese researcher who is making a lot of research on neglected disease in Swaziland and in Malawi. And for sure, the country will benefit. The country, I mean, the Malawi or Swaziland will benefit because this research will help to find vaccine, to find medicine, to treat actually the patients. But it's also important for Taiwan in the sense that this researcher can publish in the name of his university, but also of Taiwan in the best magazine in terms of public health, like The Lancet or Nature. And this is very good actually for the visibility of Taiwan and the credibility of Taiwan in terms of health research or in terms of action in different developing countries. So it's really mutual benefits, I would say.